Hello everyone. Today I would like to talk about health informatics system, the digital transformation at Sarawak General Hospital. As we all know, Sarawak General Hospital is the premier public tertiary referral hospital in the state of Sarawak, Malaysia, which is located in Kuching. It is the largest and most comprehensive healthcare facility in Malaysia, Borneo. SGS serves a diverse and geographically dispersed population across a land area exceeding 124,000 square feet, making it one of the most logistically complex hospital systems in Southeast Asia. This hospital provides a full spectrum of medical services, including emergency medicine, surgery, internal medicine, pediatrics, obstetric and gynecology, oncology, cardiology, and specialized diagnostic services. Sarawak General Hospital also functions as a teaching hospital, supporting medical education and clinical training in partnership with Malaysian Health Sciences Institutional. As we interview our hospital director, Dr. Nguyen Yi Hong, she mentioned that Sarawak General Hospital manages hundreds of inpatient beds, thousands of outpatient visits monthly, and employs a large multidisciplinary workforce of physicians, nurses, allied health professionals, and administrative staff. This is to ensure the efficiency operation of a critical institutional being a priority. For Sarawak, geographic challenges. Sarawak is a vast interior, riverine communities and remote villages present unique access to care challenges. Digital health systems are not merely an administrative convenience. They are a strategic necessity for extending quality care beyond Kuching. To achieve national health agenda, Sarawak General Hospital digital transformation have to align with Malaysia Ministry of Health strategy priorities under the 12 Malaysia Plan and the National Digital Health Blueprint, with which emphasize interoperability, patient-centered care, and data-driven governance. The digital health imperative is important because healthcare systems worldwide are undergoing a fundamental shift from paper-based, siloed operations toward integrated data-driven models of care delivery. This transition is not optional. The convergence of rising patient expectation, workforce pressure, geographic barriers to access, and the ability of major health informatics platform has created both urgency and opportunity. Sarawak General Hospital adoption of a digital health platforms represent a foundational commitment to this transformation. However, technology alone does not produce outcomes. The critical question for hospital leadership is not whether to digitalize, but how to do so in a way that is clinically meaningful, operationally sustainable, and organizationally acceptable. The promise of healthcare digital health is to reduce medical errors through clinical decision support. The digital healthcare also will be faster and more accurate diagnosis via integrated diagnostic to improve patient safety through medication reconciliation, enhance population health management capabilities, streamline administrative workflows and billing, extended specialized reach through telemedicine, real-time operational dashboard for leadership. The stake for Sarawak General Hospital is without effective digital transformation, risk widening the gap between urban and rural health outcomes among Sarawak General Hospital. It will accumulate operational inefficiency and failing to meet national quality benchmark. Well-executed digital strategy positions Sarawak General Hospital as a regional center of excellence. It will capable to serve Sarawak diverse communities with equity, precision, and accountability. Let us see the core health informatics system which used in Sarawak General Hospital. First, Hospital Information System (HIS). HIS serves as an operational backbone of Sarawak General Hospital, managing patient registration, appointment scheduling, bed management, pharmacy inventory, laboratory orders, billing, and human resources. A well-functioning HIS eliminates redundant data entry, reduce administrative bottlenecks, and provide leadership with real-time operational intelligence. Secondly, let us look at electronic health records. The EHR system digitalized the complete patient clinical journey, from admission notes, progress report, and diagnostic result to discharge summaries and follow-up care plans. A comprehensive EHR enabled continuity of care, reduce documentation error, support evidence-based clinical decision-making, and facilitate audit and quality improvement activities. The third one is the telemedicine platform. This is extend SGH specialized expertise to rural health clinics, community hospital, and remote settlement across rural interior. Through synchronized video consultation, asynchronous case review, and remote monitoring capabilities, telemedicine directly addresses the geographic barriers that have historically limited access to specialist care. The platform effectiveness depends on broadband infrastructure, clinician training, and integration with the EHR for seamless documentation. What are the critical challenges in digital health for Sarawak General Hospital? Let us look at the first critical challenge, system integration and interoperability, which divided into three segments. First, fragmented data architecture. Multiple legacy system, vendor-specific data formats, and department-level customization have created a patchwork of incompatible database. Laboratory result may not automatically populate the EHR. Pharmacy dispensing record may not sync with billing, and the telemedicine consultation notes may exist outside the primary patient record. The other section is lack of national standard adoption. Malaysian Ministry of Health has developed interoperability frameworks and health data standards, but adoption at the institutional level remain inconsistent. Thirdly, application programming interface and middleware gaps. This issue create and enable real-time data exchange between platforms. Current infrastructure lacks a robust integration engine, forcing staff to rely on manual data transfer or batch upload. The second critical challenge is user adoption and change management. The barrier is the barrier of adoption create five issues. First, workflow disruption. New systems often require clinicians to change established routines, creating friction and resistance, particularly among senior staff accustomed to paper-based processes. Inadequate training. One-time training sessions are insufficient. Ongoing role-specific hands-on training with super user support is required but often underfunded. Perceived lack of value. When staff do not see immediate clinical or operational benefit from the system, adoption becomes a compliance exercise rather than a genuine practice change. System usability issue. Poorly designed interfaces, slow response time, and excessive click path contribute to clinician burnout and workarounds. Lastly, leadership visibility gap. When hospital leadership does not actively champion and model system use, staff interpret the initiative as optional. There's three recommendation to overcome this issue of user adoption and challenge management: to establish a clinical informatic champion network in every department to provide peer support and feedback. Implement phases rollout with pilots departments before hospital-wide deployment. Conduct workflow mapping before system configuration. Introduce continuous training program with competency assessment and refresher modules. Create feedback loops allowing end user to report issue and suggest improvement. Measure adoption through usage analytics as departmental KPI, and as well as ensure executive sponsorship with visible leadership engagement. The third challenges is data management, quality, and governance, which create four issues, which is data quality standard, data governance committee, master patient index, and clinical operational analytic. The fourth challenges will create privacy, security, and regulatory compliance, which the issue would cause unauthorized access. This happen when weak authentication mechanism and excessive user privilege allowed inappropriate access to patient record. As for data transmission vulnerability, telemedicine consultation and data exchanges between systems may lack end-to-end encryption. Insider trade, where staff with legitimate access may inappropriately view or share patient information without audit trail consequences. Ransomware and cyber attacks, where healthcare institutions are prime targets for criminals. SGH must have incident response plan. Finally, third-party vendor risk. External system vendor and cloud service providers may not meet Sarawak General Hospital security standards. The strategic security framework to overcome the privacy, security, and regulatory compliance is to implement role-based access control, deploy multi-factor authentication, ensure end-to-end encryption, establish comprehensive audit logging, conduct regulatory penetration testing, develop and test a data breach response plan, provide mandatory privacy training, ensure vendor contracts include data protection clauses. Sarawak General Hospital should conduct a formal privacy impact assessment before any new system deployment or major update. The organizational readiness, building the foundation for success. It involves four levels. First level is infrastructure and connectivity. It is reliable. It need have to have reliable broadband, redundant network architecture, adequate hardware, and cloud on-premise hosting capacity form the technical foundation. The level two is workforce capability, continuous digital interaction program, clinical informatics training, and dedicated IT support staff ensure the workforce can effectively use and troubleshoot system in the real time. Level three, governance and leadership. Level four, which is culture and change readiness, a culture that reward innovation, tolerate learning curve, and actively involve clinician in system design decision is the highest level of readiness. Finally, let us look at strategic roadmap, which recommended to Sarawak General Hospital leadership. It involves four phases. Phase one is foundation, which involves 6 months of period. It conduct comprehensive system audit and readiness assessment. Phase two is integration, 6 to 18 months. It is deploy enterprise integration layer standardized data format, achieve full HNI EHR interoperability. Phase three will include 18 to 36 months of optimization. This will launch clinical decision support tool within EHR, and finance phase is innovation. It took about more than 36 months. It's explore AI-assisted diagnostic, predictive analytics for patient flow, and population health management platform. The key message for leadership is digital transformation at Sarawak General Hospital is a destination. It's not a destination, sorry. It is a continuous journey of improvement. The system described in this briefing are tools. The true transformation happen in the culture, processes, and people of this organization. Leadership commitment, sustained investment, and genuine clinician engagement are the irreplaceable ingredient of success. I think that's all for now for our talk today. Thank you for your attention.